Greetings, everybody. It's Brian Terrian here from the Disability Digest, and welcome to our YouTube live presentation today with our guest, Mark Sneerowicz. Thanks for joining us, Mark.
Thanks for having me.
It's Brian Terrian. Oh, get a little feedback. Hang on. Welcome. And of course, as always, the wonderful Jam is here to help us out. So thanks for joining.
Hi,
So
everybody.
So for today's event, we're excited to help you understand what you're entitled to for benefits. Once you become approved for your Social Security disability benefits, you will soon be Medicare eligible. So Mark is, I'd say, in my opinion, one of the most qualified to help out with this. You have 15 years of experience. You have your own personal clients that you take care of, but you helped a lot of companies throughout the US set up and help them work with other individuals. So thank you for joining us. Before we get started with Mark, a few things. In the next 2 weeks, we're going to have additional information to help you understand what you're entitled to. Next week, you'll hear from Daphne and Philip, who are advocates that work here that have been helping people get approved for their disability benefits, help them with their Medicare choices. So they have their own personal experience as disability recipients and then the experience with others. So we're going to do a deeper dive on the information that you'll learn here. And then the following week, October 5th, we're going to actually show you how to break down a plan, because you should have by that time an understanding of where your plan is at, if it's changed, and how to evaluate that versus the new plans released in October. So if you're new here and you don't want to miss any of this, hit the subscribe button, ring the bell, and we'll keep you updated. All right, good. So let's get started. I just need to make a little adjustment so I make sure I know what I'm talking about here. And then we will get on with the show. So first of all, Mark, in doing this work, how could you help somebody understand, from an eligibility standpoint? One of the common questions we receive is okay, well, I got approved for disability. When am I going to be Medicare eligible? Let's start there, then we'll roll through all the different parts of Medicare. We'll talk about Medicaid. We'll talk about how to prepare for the upcoming season. How would you address that?
Sure. So the easiest way is that once someone has received 24 SSDI payments, then they automatically become eligible for Medicare. That's typically, there's a 5-month waiting period before the onset date can be considered. So it's 29 months. But the way it's been going with a lot of the courts recently is that people are eligible almost immediately upon, eligible for Medicare almost immediately upon receiving their notice of award, because they were injured or became ill more than 24 months ago. So either for most people over 65, once they turn 65, of course, they're eligible for Medicare. And then under 65, it's after they've received 24 SSDI payments.
Okay. So I have a prop here, Mark and Jam. And for those of you that are out there, what you're looking at is a actual notice of award. And for those of you going through the approval process, this is what you ultimately want to receive. And by the way, Jam is putting some questions in the chat. If you could answer those, it would help us understand how to direct our conversation. But okay, so when we look at this award letter, the top line here that I have in red explains that this individual is entitled to monthly disability benefits May of 2021. So Mark, based on this, Medicare eligibility is?
May of 2023.
2023, coming up. Okay,
Yeah.
great. So not to be confused with the second line of text that's there. That is the date that you were found disabled. And remember, folks, there's a 5-month waiting period. So that's the November to May part, right? Any exceptions to that?
The 5-month period, I believe, is waived for people that have ALS or end-stage renal disease, but I would need to double check that.
Right, right. Yeah, so, I was just in a meeting earlier. I think the gap between that is one of the biggest misunderstandings I have about our system. And there's really not a lot of good answers other than, getting insurance from the exchange or from your spouse or Cobra. Did I miss anything people do to fill that gap?
That's pretty much it.
Right, right. Okay, so let's start with the basics. Somebody is in this award example that I just showed. They are Medicare eligible. Hopefully they get their card on time, right? And they're eligible for basic Medicare. Can you walk us through that, Mark, and what that includes?
Yeah, so original Medicare includes two parts, Part A, which is the hospital side of Medicare, and Part B, which is the medical side. A lot of people think that Part A covers everything that happens when you're in the hospital, but it doesn't really. It's more of a facility fee, sort of your right to be in the building and receive treatment, those sorts of things. For Part A, there's a $1,556 deductible in the year 2022. Of course, 2023, that's likely to go up. But and then on top of that, there is the Part B. So backing up a little bit, actually, Part A is an entitlement. So for most people, you won't have to pay anything for Part A. Part B, the medical side. So that would include all of your medical diagnosis and treatment. So that would be your surgery in the hospital, your testing in the hospital if you're admitted to the hospital, but also your doctor's visits outside of the hospital, physical therapy, x-rays, those sorts of things are all covered under Part B. There is a $233 Part B deductible. After you've paid that, then Medicare will pay 80%, which leaves you with 20% of the total bill. Part A has no premium, as I mentioned. Part B has a premium. Most people in the United States in 2022 pay $170.10 for their Medicare Part B. If you're drawing Social Security, which of course people with SSDI are, then that $170.10 is deducted automatically from your Social Security check. If you are receiving financial assistance from the state, that Part B premium might be paid by the state for Medicaid or other benefits like that.
Okay, so let me unpack this a little bit just to make sure. Part A is the hospital part.
Yeah.
And what was the deductible again?
$1,556 for the first 60 days.
So once somebody, if you go in to the hospital, once you've met that deductible, it's the 80-20 relationship, right? With Medicare. Is that right?
So the 80-20 is the Part B side. So the Part A deductible can be charged theoretically 5 times per year, because it could be charged every 60 days if you're in the hospital multiple times, more than 60 days apart. The Part B deductible is the $233. And then once you've met that, then you would be responsible for 20% of your medical costs.
Okay, so once you meet the Part A deductible, is everything covered?
Well, it depends what you mean by everything. So really, yes, in terms of what the intention of Part A is, which is basically a facility fee. But in terms of your surgery, any testing they might do while you're admitted to the hospital, that's all covered under Part B. So that would be the 20% after the $233 deductible.
Okay. All right. So you have Part A, and Part B has a premium that is $170.10, right?
Yes.
Okay. looking at the flow, because we've got some other letters to go through, what would be best to go through next to explain to the audience? C or D or?
Well, yeah, so I think D makes the most sense to start. So Part D is the prescription side of Medicare, which is not included under original Medicare. You do have to opt in or select a Medicare Part D plan if you want a prescription plan to go along with your original Medicare, which of course a lot of people don't choose that. We'll get to that in a minute. But for most people, the Part D prescription coverage does cost an additional premium. Of course, like I mentioned briefly before, if you're on Medicaid or you're receiving other financial assistance from the state, your Part D premium could be covered by the state. Now, the premium will vary based on the drugs that you yourself take. So we enter in all of the prescriptions that you take, the name of the drug, the dosage, and the frequency, and then all of the plans available in your zip code are listed by estimated annual cost. So you might have a neighbor that's on plan XYZ and you're on plan ABC because your drug usage is completely different.
Okay, great. So we have A and B and D. Now, what parts of these are like mandatory? Like, do you have to take everything? Do you have to pay the 170? Do you have to get a Part D?
Yeah, so if you have other credible insurance, so credible insurance is defined as insurance that's equal to or as good as or equal to or greater than original Medicare. So if you have other insurance through your spouse's work, which is the most common scenario, then you do have the ability to decline Medicare Part B. You might as well take Part A because there's no premium for it, but you can decline Medicare Part B and continue on your spouse's work coverage, assuming it's credible, until they retire or quit or whatever, until that coverage ends. And then at that point, you could go on to Medicare Part B, assuming your insurance through your spouse's work is credible, then you can start Part B whenever the time comes with no penalty. The time that you're assessed a Part B penalty is when you have not had credible insurance since you were eligible for Medicare, but you chose to decline Medicare anyway. Then they'll hit you up with a 10% penalty for every year that you didn't have Medicare Part B after you were eligible.
Okay, so if you don't have credible coverage and you decline Part B, they're going to hit you with a penalty.
Eventually, when you enroll in Part B, yes.
When you enroll in Part B, right?
Yeah.
Okay. And I know people that have rolled the dice and are not on Part B. I know two people. So they'd save money, but they don't have credible coverage. It's just a cost saving thing, right? So
yeah, that's a mistake because when you eventually need Part B, which the only time you'd enroll in Part B if you chose to not take Part B because of cost savings, the only time realistically you're going to enroll in Part B is when you need Part B because you now have a new diagnosis, you were injured or something like that. And at that point, if you do not have credible coverage, then you're restricted to when you can enroll into Part B. You can only enroll January 1st through March 31st for a July 1st effective date. So today being September 21st, if you all of a sudden decide, oh, wow, I was just diagnosed with something, I need to get onto Part B, you would have to wait until January to enroll for a July 1st effective date. Now, of course, if you have credible coverage and your credible coverage ends on October 1st, well, then on October 1st, you could enroll into Medicare Part B with no penalties or anything. So it's usually a pretty poor choice to decline Part B if you have no other insurance coverage options, because then if you become injured or ill, you'll be responsible for nearly 100% of the costs of your medical care. So,
yikes.
Yeah. Now, one thing just to mention that if you did have credible coverage, but you wanted to enroll into a drug plan, you only need to be entitled to Part A or eligible for Part B to add a drug plan. You don't have to take Part B in order to get a drug plan if you have Part A.
Right. Yeah. For those of you that are listening out there, I've been around this for a long time and I'm still learning stuff. So this is awesome. And at the end, I mean, again, if you're just joining us, welcome. Thank you. There will be other resources to help you out, other live events that we have. There'll be an opportunity for some people to get some personal support directly, and we'll talk about that as we wrap up at the end. Okay, so let's see, we've covered A, B, D. What are we on to next?
So even though we're out of order, we'll talk about part C. And Charlie.
Perfect.
So
Charlie.
part C. So remember, we covered part A, which is hospital, part B, which is medical, and part D, which is prescriptions. Now you have part C, which is a combination of the three. So you have your part A, hospital, part B, medical, part D, prescriptions, all rolled into one plan, administered by a private insurance company, but funded by the federal government. So rather than Medicare paying 80% of every bill, now they pay a flat fee of some sort to the insurance company that you choose. And then now that insurance company administers your benefits. So you still have your part A and B benefits. They're just administered by a private insurance company. And now when you enroll in one of those plans, which often vary from county to county, then now you might have co-payments, but you also might have additional benefits and other things that are not included with original Medicare.
Okay.
So in that case, you would only need to show one card. You would have one card that you would show to the doctor, you show to the hospital, you show to the pharmacy, you show to your physical therapist, and that would just be your Medicare Part C plan, which is also called Medicare Advantage, and actually more commonly referred to as Medicare Advantage plans.
Okay, great. So Part C, you leave traditional Medicare, is that correct? Or am I saying that the right way?
Well, you're opting for a private insurance company to administer your benefits. So you still have, you're not giving up or leaving you're not giving up your Medicare benefits. Technically, I guess you would be leaving original Medicare to opt to have an insurance company administer your benefits, but you still have all options every year to change your Medicare Advantage plan. You can go back to original Medicare if you desire to do so. So you're not locking yourself into anything for life. But yeah, you are choosing to have an insurance company rather than the government administer your Medicare benefits.
Okay, would it be safe to say if somebody is employed and they have insurance through their employer, like an HMO or PPO, would be a similar environment?
What do you mean by similar plans?
So with a Part C, there's an HMO.
Yeah.
There's PPO.
Yeah.
And if you're getting insurance through your employer, it's probably an HMO, right? Are there some similarities? So people that are new to this, they could say, well, it's kind of like that.
Well, the cost sharing is usually different, but the similarities are there in the sense that an HMO has a fairly strict network of doctors. If you go outside of that network, you'll have to pay 100% of the costs of the bills, except in the case of emergent or urgent situation. So, you're out of town in another state, another country, perhaps, and you have you cut yourself cooking, you have a bad illness, you don't know what's going on, you get in an accident, you're covered with your HMO, just like you're in your home or your home county. But with a PPO, you typically have a larger physician network with an out of network option, but that's typically at quite a higher cost. So HMOs are generally going to be cheaper. Now with the Medicare HMOs and PPOs, generally there is no deductible, or the deductibles are quite low. With group plan or employer HMOs and PPO, usually, unless you have a really, really good plan, usually there's some sort of a deductible of $1,000, $2,000, $5,000, $10,000 before the plan benefits begin. But with Medicare, there's typically Medicare Advantage plans, there's typically either no deductible or a very small, relatively small deductible.
Okay. So we've talked about what they are, Medicare Advantage plans. Like, I mean, are we at the point where it's helpful for people to understand, like, I get it, but why would I do that? Why would I do that versus staying with A and B, or are we going, should we go there now, or is there, you want to
Sure.
keep going through the alphabet?
So the primary reason to enroll into a Medicare Advantage plan is to reduce your exposure to large medical bills and to add other benefits that might not or that aren't included with original Medicare. Now, some, not all Medicare Advantage plans include benefits such as dental, vision, gym memberships, over-the-counter credits. Some Medicare Advantage plans in select counties around the country will actually rebate or refund or return your Medicare Part B premium or part of that. So that obviously is a benefit. If you stay with original Medicare and nothing else, those deductibles are quite high. There is no annual or annual or lifetime maximum out of pocket. So you're going to pay 20% of your bills and those deductibles, regardless of how expensive your healthcare is. So with Medicare Advantage plans, you often will have or always have a Medicare maximum out of pocket. So when your co-payments add up over and over and over, you do reach a ceiling, which varies again by county, where once you reach that ceiling, then you're 100% covered with no out-of-pocket costs for the rest of that calendar year. Now, the other option is to add a Medicare supplement to your original Medicare. That's where Medicare pays first and the supplement or Medigap plan. So Medicare Part C and Medicare Advantage are the same thing. A Medigap plan and a Medicare supplement are the same thing. And so the supplement will pick up most of what Medicare doesn't. Now, when you're under 65, Medicare supplements are either not available, they're only available in 30 states to people that are 65 and under. And in those 30 states, in most cases, the Medicare supplement premium for someone under 65 is exorbitantly expensive, sometimes 2, 3, 10 times the monthly premium that you would pay if you were 65. So Medicare supplements are not terribly popular among people 65 and older, or 65 and younger, which is why the Medicare Advantage plans are the most common options.
Okay. All right. I just want to back up a little bit on Part C, and there's a few things I want to make sure that the audience understood. If somebody chooses an Advantage plan or is looking at it, there is a premium that is typically zero. Is that right?
In many areas, in many parts around the country, there is a zero monthly premium, in addition to your Medicare Part B premium.
Right.
But generally speaking, in most areas, the Medicare Advantage premiums are certainly less generally than the Medicare supplement premiums. Okay,
so low to no monthly costs, let's say that, and then you have the other benefits that are put into this, which is your ability to see your doctors, your specialists, hospital coverage. The Part D is also in there, right?
Yep.
And then you mentioned OTC. Can you explain what that is? Was another, sounds like acronym that would be helpful.
Yeah, so some Medicare Advantage plans will include an OTC or over-the-counter benefit.
Yep.
So an over-the-counter benefit is often a monthly or a quarterly dollar amount credit, and you are able to select from a catalog a certain number of over-the-counter items like vitamins, supplements, Tylenol, aspirin, sometimes Band-Aids, sometimes sunscreen, different things like that, where you can select those benefits or those items at no cost to you as long as you remain under that quarterly or monthly limit.
Okay. And so this would help people from using their own resources to purchase these items, right? Yeah. Is there a general range? Like, is it $1 or $2? Anything you can speak to on what the expectations are that what somebody might find commonly
for Medicare, the over-the-counter
for the OTC?
Yeah, so for the over-the-counter benefit, I mean, it varies dramatically around the country, depending on depending on where you live and depending on which type of plan you enroll into. But, I would say very casually and generally speaking that, a common number might be, $50 a quarter,
Yeah.
something like that. So a couple $100 a year. But again, there are some that are less than that, and there's certainly some that are quite a bit more than that. It just depends.
Okay. So there's a variety of different benefits that are in the Advantage plans, and then there's Advantage plans that there's HMOs and PPOs. Is that right?
Yep.
Okay. So you can have some flexibility if you choose to go with a PPO, so you can see doctors in the network.
Yeah, one thing that's with Medicare HMO plans, some people just don't like the concept of HMOs, but generally what we find is that the HMO networks are usually pretty robust, and unless you are traveling all over the country, HMO plans are usually going to meet the needs for most Medicare beneficiaries that opt for a Medicare Advantage plan. Keep in mind with the Medicare supplements, there is no physician network other than does the doctor accept Medicare? And if they do, then you're good to go nationwide. But Medicare Advantage plans have the physician networks, but HMO plans certainly are the more popular options because usually we can find plans where all the doctors or most of the doctors are accepted in the network. And then generally, if you were to get a referral from your primary care physician for a specialist, chances are they're going to refer within their same hospital system, and that doctor is likely going to be in the network as well. So you don't run into these network issues that a lot of people fear.
Yeah. Okay. Good point. And then the Medicare supplement or Medigap, that concept that you were talking about, that sounds like there's some geographical flexibility in there because you don't have the doctors, you can go anywhere, right?
That's right. But keep in mind also Medicare supplements do not include prescription drug coverage. The Medicare Advantage plans generally do. So you would have to pay extra for a Part D prescription drug plan. But yeah, with the Medicare supplements, you definitely have greater physician flexibility as long as a doctor accepts Medicare, whether it's in Miami, Los Angeles, Cheyenne, Wyoming, doesn't matter. As long as they accept Medicare, you can go see them.
Right. Okay. So regarding the Medigap, I just have up on my screen here. That as you had mentioned, there's a lot of restrictions, but this is an example from Medicare.gov in New York, that if you happen to be in New York and we're interested in the Medigap plan, you see here, this is Plan G, right? That I learned from you, it's a pretty popular one. You could expect, this is, I think, a 55-year-old male that doesn't smoke is what I put in. So you'd pay $278 to $476. So my understanding from you is this would be more on the lower side compared to what you've seen for other under 65s around the country. But point is, in this example, somebody might be able to make this work for them. Right.
Yeah. So the difference in that premium obviously is different insurance companies. So a Plan G is a Plan G. It doesn't matter who offers it. The benefits are the same. It's sort of an analogy might be, if you buy Wonder Bread at the grocery store versus Costco versus the local convenience store, the prices are going to be different. So the company that you choose can change the premium based on or despite it being the exact same type of coverage. So that's why there's a range there. But if you were to be 65, for example, these premiums would be quite a bit less. It's just that they're inflated when you're under 65.
Okay. Yeah.
And G is Plan G is the most comprehensive Medicare supplement or Medigap plan available currently to people that are just going on to Medicare for the first time.
Okay. So here's N, it's a few dollars less.
Yeah.
Yeah. Okay, great. Great. So for those of you watching out there, thank you. We're going to take some questions in a few minutes from Mark. So if you have questions, you can put them in the chat, and Jim will organize those. And also Jim has a survey in the chat that if you haven't answered that, that would be helpful. And if you're new, welcome. Hope you enjoyed the show. If you missed part of it, this replay will be available afterwards. Okay. Well, this has certainly been helpful so far. Now, let's go on to another popular topic in the world that we live in here, and perhaps you have others that are like this, is we have individuals that are Medicaid eligible. Because of their resources, they're eligible for Medicaid. So when they become Medicare eligible, there's still the opportunity to have both, which is massively confusing for people. So could you break that down, how the two work together, Mark?
Right. So you're eligible to have Medicare and Medicaid together. If you do, you're referred to as a dual eligible. Once you're eligible for Medicare, if you're on Medicaid now and you become eligible for Medicare, you have to take Medicare, because Medicaid, of course, wants some help from the government to help pay those bills that they've been paying all this time. So the two will coordinate together. Once you're on Medicare and you already have Medicaid, your cost sharing for your health care shouldn't change. It should still be zero for most things. Your prescriptions might change. You could, if you qualify, which I'm certain you would, for a low-income subsidy, then your most expensive drugs in 2022 would be $9.85 a month. But those are the most expensive drugs. So typically, you'll pay somewhere between $0 and $4 for most of your drugs per month. So they do coordinate care. And then in terms of Medicare Advantage plans, in some counties, there are plans called DSNPs, which stands for Dual Special Needs Plans. So those plans are specifically, they're Medicare Advantage plans that include drug coverage, of course, that are specifically designed for people that are dual eligibles or that have Medicare and Medicaid. And those plans will help coordinate between Medicare and Medicaid. They will give you oftentimes additional benefits that aren't included with Medicare and Medicaid, like extra dental, vision, gym membership, over-the-counter benefits, transportation sometimes, things like that. Typically, of course, when you're on Medicaid and you go on to Medicare, the state will pay for your Medicare Part B premium, that $170.10. So things should not get more expensive for you once you are eligible for Medicare when you already have Medicaid.
Mark, who pays first?
I believe Medicare pays first, and then Medicaid pays after that. But actually, that's a good question. I would have to double check that.
Okay. Right. So if you're dual eligible, and for those of you that are out there, the general guideline that we use, and states are different, is that if your income is below $1,500 and you're single, you're likely a Medicaid candidate. If it's over that, probably not. If you're married, it's 2,500. I don't know if the figures that you use are different, but those are the ones that if we meet somebody that falls into the category, we encourage them to go forward and apply and check it out. So a few things I just want to recap here is that if you're dual eligible, you keep your Medicaid, you can get onto Medicare, you can get a D-SNP plan that has additional benefits. And these additional benefits could possibly be some of the shopping credits that we talked about, right? Dental, hearing, vision.
Yep.
Any others that?
The transportation's common. 24-hour nurse hotline's common. The meals after being in the hospital is sometimes an option as well. Or not an option, often included.
Yep. Food cards. I've heard about those, right?
Yep. Yep. So sometimes you get credits for different groceries and whatnot, but it varies. Like I've mentioned a number of times, I can't be more clear about this.
Yeah.
You might have a relative that lives in the same state as you, but 4 counties over, and their Medicare health plan options could be completely different than yours are. So it's definitely a county by county benefit.
Right. Right. As a general rule, and not to deviate and get off topic here, but the more the denser the population, the more competitive it is, and
Typically.
the better the plans. Like I'm in Vermont, right? When I look, there's not many plans. There's probably 15, 18 plans, but some markets, like, right? Like, have you seen markets where there's like a lot of plans?
Yeah, 60 plans is not uncommon, but on the flip side, there are some counties, usually rural counties, but there are some counties around the country that do not have Medicare Advantage plan options.
Oh, really?
Yeah, but so if you live in a county that has no Medicare Advantage plan options and you happen to live in a state where Medicare supplements are not offered to people under 65, then your only option there is to stay with original Medicare and add in a drug plan until you turn 65, and then you could enroll in a Medicare supplement.
Yeah, that's a tough one. Okay, so the recap on Medicaid is you pick up extra benefits, right? And that can help you by moving into that. One thing I wanted to ask is there's other plans for conditions. Can you educate our group about that, what they are, how they work?
Yeah, so like DSNPs, dual special needs plans, there in some areas there are also CSNP plans. It stands for chronic special needs plans. So those are people that have a select list of chronic illnesses. Diabetes is a common one, for example. And if you happen to live in a county that offers that type of plan and you qualify with the chronic illness, then like the dual special needs plans, they often help coordinate better with your medical care, provide you with extra benefits, things like that.
Interesting. So diabetes is a common one.
Yeah, there are numerous illnesses that you could qualify for, but again, it's county by county, so certainly worth depending on where you live and what your chronic illness might be, it's certainly worth looking into those options.
Okay. All right. So before we wrap up here, I just want to go back and cover what we've discussed here and make sure you got it right. So somebody becomes eligible after 24 payments, right? And they get their card and they have access to Medicare A and B, right? A is no monthly charge, B as the $170.10 for most, right?
Yeah.
Okay. So, and then somebody is expected to get a Part D plan for drugs, right? And if they don't get it right away,
if they don't have other credible coverage, when they do decide to get a Part D drug plan, which generally is going to have to be in the annual election period between October 15th and December 7th for a January 1st of the following year effective date, then they would receive a penalty that they would be charged every month for every year they did not have a Medicare Part D plan once they were first eligible. But again, keep in mind, if you do have credible coverage through typically a spouse's work, then you won't have to pay those penalties.
okay. So that's A, B, and D, but the challenge with just A, B, and D is you've got this gap in your coverage with traditional Medicare where you're exposed to 20%, right?
That's right.
So the way to solve that is you can get a Medigap plan, which we talked about, limited availability, high price.
For under 65, yeah.
For under 65. Yeah, I keep thinking most of our group is. Or the Medicare Advantage plan, which is the Part C, and Medicare Advantage is a combination of A, B, and D, all put into one, right?
That's right.
So those are the options. And if you're in the Medicare Advantage area, that you can also look at plans that may even provide additional benefits, which could be the D-SNP, right, and the C-SNP.
Yep.
That's our summary. I miss anything?
Now, one other thing just to mention, though, is that if you do have a chronic illness, or if you are a dual eligible, so you have Medicare and Medicaid, but a chronic special needs plan or a dual special needs plan are not available in your county, you can still enroll into a regular Medicare Advantage plan and still receive all of those benefits.
Okay, good. Mark, this, in my understanding, is the time of year where people need to take a look at, like, what's going on with their current plan, evaluate it. Can you give the audience some advice of, like, what's going to happen, what they should look for, what are some of the common pitfalls that people get stuck with, and hopefully they can be ready and be prepared?
Sure. So Medicare Advantage plans are on a calendar year cycle. So from January 1st until December 31st. So the plan that you have right now is good until December 31st. Now on January 1st, the 2023 plan will begin. There's nothing that you need to do to re-enroll in the current plan that you're in. If you like it and you're happy, you can do nothing and it'll automatically re-enroll. Sometime around now, maybe you've already received it. Maybe you'll receive it in a week or so. You should receive, if you have a Medicare Advantage plan now, you should receive the annual notice of change letter. That annual notice of change letter is going to tell you how your plan is changing for 2023. It'll compare side by side your 2022 benefits and then the new 2023 benefits. If you're happy with it, you don't have to do anything at all. Beginning on October 1st, the 2023 benefits will be released nationally. So if you don't have a Medicare Advantage plan, starting on October 1st, you can look at what the 2023 benefits will look like. Beginning October 15th until December 7th, there is the annual election period where you can pick a 2023 plan that will begin on January 1st. You can enroll into that plan. If you enroll on October 15th and then you find a different plan that you like on November 30th, you can change and enroll into that plan. And then now that plan will go into effect on January 1st. January 1st through March 31st, you actually have one more chance to make one change. If you have a Medicare Advantage plan beginning on January 1st, you can actually switch one more time for the first day of the following month until March 31st. Now, I would encourage you, of course, if you do have questions about a plan, reach out to Brian, talk to a broker, learn about the options available to you, so you don't have to go through the painful process of reviewing all the plans yourself and maybe getting confused by people that might not understand how the plans work. Just present your information, which would be your the doctors you see, the prescriptions you take, which would be the name of the drug, the dosage, and the frequency. Also the pharmacy sometimes that you prefer to use. And then the analysis can be done to help you select the most appropriate plan for 2023. And then you'll be done with that and you won't have to worry about it moving forward.
Right. Great. Thanks for that. Mark, I want to be respectful of your time, and it's 12:59. So two things. For those of you that are listening out there, I see some of the comments and the word complicated has popped up a few times. And yes, it is complicated. And we're going to take some questions for Mark in a moment, but I just want to point out a few things. Next week, we're going to give you a different perspective on the benefits to be reviewed by two advocates that are here. The week after, we're going to actually show you how to break down your plan, take your doctors, put them in the network, your medications, all this stuff. We do that work here for you, but we're limited. It takes a lot of work, actually, right, Mark, to take somebody's whole health and put it into an evaluation. So we really only have the ability to deal with 220 people during this stretch of time. which there's 179,000 people here, 33,000 on our YouTube channel. It's just not enough. So that's why we're giving all of this information away. So if you want to be put on the list when this is done, there'll be a link below where you can request a benefit review and you can put in all your information. We'll evaluate it for you if you wanted the first 220. So Jam.
Ryan, could I add something really quickly here? So it is true that from an outward glance, Medicare is confusing. The analogy I like to use is if you have a 200-piece puzzle and you don't know what the picture is and someone just dumps out all the pieces on the table. But then if you're given a picture and you realize it's a rainbow, and it's fairly easy at that point to put the pieces together because you know how they all go. And so if you speak with someone that understands how this works and you provide them with a little bit of information, like your doctors and your prescriptions and your zip code, they can do that analysis for you at no cost. It's illegal to charge for this service. Right. And so it is pretty easy to figure it out once you start breaking it down. But I do understand from an outward perspective, if you're new to Medicare, it seems overwhelming. But if you talk to someone like Brian that understands this, it can be pretty simple to figure out over time.
Yeah, good point. Thank you. All right, Jam, you ready to roll? Mark, you just go like this when you got a split, because I know you got something coming up. All right.
Yeah.
All right, so this one's from Tim. I got a job and I'm on disability, and that took my kids' insurance because I make too much. Can they do that?
They took away the SSDI?
No, his kids' insurance.
Oh, his kids' insurance. Unfortunately, that would be a little bit outside my wheelhouse because I know the ins and outs of Medicare, but not necessarily group health plans.
Right.
Okay. This one's from AFI. Some states don't pay the Part B if you get Medicaid? ?
Most states all states that I'm aware of will pay the Medicare Part B premium if you reach their threshold of poverty level.
Mm-hmm. This one's from Natalie. I start my Medicare November 1st. This year, I will be getting the dual due to me having Medicaid. I'm concerned, how long do the Medicare saving program take if I'm approved? Part B.
Well, so they can approve that retroactively as well. So if they do charge the Medicare Part B premium for the first month or two because they haven't processed the application, but then they find that you were eligible on November 1st, you will have that Part B premium refunded to you. All
right. This one's from Faith. If you take a Medicare Advantage program, can you still use regular Medicare? Medicare also situation so town.
So once you enroll into a Medicare Advantage plan, your Medicare benefits are administered by the insurance company that you choose. So you would not be able to continue to use your original Medicare card. All of your benefits would need to be run through the insurance company that you choose. So that's a long way of saying, no, you can't use both.
Mm-hmm. This one's from Sherlock. If I ever leave my Advantage program and return to the original Medicare program, are there restrictions or issues I should be aware of? Or is that an easy change to make?
So during the annual election period from October 15th through December 7th, if you have a Medicare Advantage plan, you are able to drop that Medicare Advantage plan, go back to original Medicare and a drug plan. Now, the issue there is that there could be restrictions if you wanted to add a Medicare supplement or a Medigap plan, because you would need to medically qualify. Now, there are some exceptions there as well, that if you went onto a Medicare Advantage plan for the first time, you've been on that Medicare Advantage plan for less than a year, then you would be eligible for guaranteed issue for a Medicare supplement. But let's say you've been on a Medicare Advantage plan for 3 years. Now you want to get onto a Medicare supplement. You have no other special conditions or special situations like you've moved or something like that. Then in order to get onto a Medicare supplement, you would have to medically qualify to do that. And that could be a challenge depending on your health conditions.
Some risk involved.
Mm-hmm. From Natalie, I will be taking Medicare Part A and B. Am I also covered for my prescriptions medicine? I will be taking United Healthcare. I'm confused.
So United Healthcare offers multiple different plans. They offer a Medicare Advantage plan with drug coverage, a Medicare Advantage plan without drug coverage, and a Medicare supplement. So it's really hard to say without knowing the specific plan you have. If you already have the health plan card, you can look on the card. If it lists a prescription drug benefit, then your drugs are covered. Now, it is also possible that you could have a United Healthcare standalone prescription drug coverage. So you might have drug coverage, but not health coverage. So it's really impossible to know. If I were to look at your card, I'd be able to tell you in a couple of minutes. But I would certainly, you can call the number on the back of your United Healthcare card, and they would be able to guide you through to figure out exactly what type of coverage you have.
Right. This one's from M. Steele. Is it true in order for my wife to get Part B, she has to wait until I retire? She is 68 and I am still working.
No, that's not true. She could apply for Part B now, assuming that the coverage through your work is credible. Sometimes having original Medicare plus an Advantage plan, going back to Medicare and adding a Medicare Advantage plan would be less expensive and more comprehensive than the work coverage. It just really depends on how good your work coverage is, what the premium is to keep your wife on that policy, but she does not have to wait until you retire.
All right. This one's from ADH. At this time, do all Medicare plans, original HMO, etc., still have the donut at the end of the year for an individual who has high prescription cost?
So just a quick clarification, of course. So original Medicare does not include prescription costs, so that would not apply. The donut hole or the coverage gap relates to prescription coverage health plans. And yes, the donut hole coverage gap is being eliminated, but this year for 2022 and next year, 2023, there is the prescription coverage gap, otherwise referred to as a donut hole. It is getting smaller and smaller, so you have more and more coverage, but it does still exist.
Mhm.
All right, this one's from Tony. Do you have to order from the OTC catalog or can you shop at a local pharmacy?
That varies based on the plan, but some plans will allow you to shop at the pharmacy and then submit your bills for partial reimbursement. I can probably do 2 more questions.
Okay.
All right. From Donna, I have United Healthcare Part A and B. Is it worth it?
I have Medicare Part A and B. I have United Healthcare Part A and B. Is it worth it?
Mm-hmm.
So I'm not really sure I understand the question. So Medicare A and B would be through original Medicare. United Healthcare is an insurance company, so they would either offer a supplement to supplement A and B or a Medicare Advantage plan. And again, without knowing the specific plan details, without knowing the cost sharing for that specific United Healthcare plan, and without knowing what other options are available in the area, it's pretty hard to decide or to state whether it's a good deal or not. Very well, maybe, but maybe there are more appropriate options based on how you use this plan. So I would recommend talking to a broker or perhaps doing your own research just to see what other options are available in your area.
Mm-hmm.
Is that the last question?
I think I can do one more here.
One more. Okay.
Right. One from A1, is that a gross or net after Medicare comes out for the 1,500?
It's the gross, and the 1,500 obviously is not a national number. It varies by state. And in addition to Medicaid, there are other financial support options like low income subsidy, extra help, pharmaceutical assistance programs that people might qualify for, even if they make too much money to qualify for Medicare, or excuse me, Medicaid.
Good.
But thanks, Brian. Appreciate your time. And I'm pretty easy to find here on Google with my last name. So if anyone has any questions, you're welcome, or Brian can do whatever needs to be done. But thank you for your time.
I appreciate you turning up. This has been great information for me. Like I said, I've been around this. I learned something, every time. So we'll hang out for a few more minutes, but if everybody just put a shout out to Mark in the comments, thank him for coming out here, and I appreciate your time, and till the next time. All right.
Thanks, Brian. Thanks,
You bet.
Cam. Take care. Bye-bye.
Thanks, Mark. Bye.
All right. Okay, let's see how I can do with the rest of these.
All right, we do have a couple more to go. All right, this one's from Melissa Ryan. I need hearing aids. I only have Medicare, but have extra help. Should I
Yeah.
try an Advantage?
There is hearing benefits that are in the Advantage plans that could definitely help you solve that. You know, it depends on the plan. If that's your primary interest, then, you know, your strategy would be to look for a plan in your area that's got the best coverage for your hearing, for sure.
All right, this was from Cambo. Can I open an irrevocable trust? I put my business once in there as the grantor and be the beneficiary and be protected from the SSDI income passive levels.
It's similar to a corporation, and you know, corporation, I don't know about a trust specifically, but I'm gonna answer it this way. There are people that do work and are disability recipients that have a corporation. It may be, if a trust can behave the same way, where money can go into the trust and then you take a check out of the trust, that is a totally legal strategy to do. Word of advice that I have is, if you're totally crushing it and dumping a bunch of money into this, and you're the only one that's glaringly obvious as, you know, the primary shareholder in that, then you're going to raise a flag. So, but I'll give you an example, just a little more on this. We had somebody that started like a consulting advising type business, became successful, got a corporation, started to get more business, couldn't handle it all, stepped back from their interacting part, like doing the delivery of services, and hired others. Still has this business, corporation's running it, just takes like an income out of it based on, you know, the time put in, and the corporation structures it and is doing well. So can be done.
All right, this one's from Farley Irving. Do anyone know of an attorneys who would represent a client living abroad?
Yeah, I mean, we have worked with members of the Disability Digest that wanted to have their case represented by us abroad, and I expect there's others out there that do it. In today's environment, there's like geographic barriers have been dropped because of the way information is exchanged and the way that the disability hearings are done by phone. It makes it a lot easier to generate, produce a good case, and deliver services. So, yeah.
This one is more of like a statement, Brian. This is more. This is from A1. I've talked to people and feel like I got spun around. People just try to tell me something.
Well, I don't really know what to say about that. Well, let me see if I can address it this way. One of the challenges that we have here at the Disability Digest is people come here looking for something that we don't deliver. I don't know exactly what it is that you're looking for, but people come here and they're looking for us to help them increase their food stamps. We don't do that. People are coming here to help them. You know, I've had all kinds of requests, so just leave it at that. So I'm not sure exactly what you're looking for, but I will say this. If you're looking to get your disability benefits approved, or if you're approved for disability and you want to keep them, or you want to maximize them, that's what we do every day. And I'd like to think that we're good at it. Probably the only ones that I know that actually do all of that. So we'd love to help you if that's something we can help you with.
All right. This one's from Melinda. I have Elixir. Is this a good insurance? They gave it to me.
Don't know. I don't know like what plan you're on. In my experience in working and helping people make their healthcare choice, what I have learned is there's 4 top companies that I am comfortable suggesting to people. And there's other companies in markets, like if you open up and go to Medicare.gov and you look for insurance, you'll find some of these second and third tier ones. They might be fine. But historically, I've found challenges with them. And the larger companies that do the volume and they've got all the service and they've been doing it for years, that's it. So I don't have enough to go on. I'm just speaking generally based on solving somebody's problem with least amount of risk of having a company service related issue.
All right. This one's from Anne. I'm on SSI age 55. How much money can I make a month and still get my benefits?
If
SSI.
you're SSI, so on SSI right now, Jim? Okay. So for Social Security disability, I want to make sure we understand the difference. SSI is a needs-based program. You're already on that. If you've worked enough and qualify for disability, you can go through the application process. And Social Security regulation says that you can earn up to $1,350 a month and still apply. Now hold it. Calling a timeout here because you can apply, but getting approved and working is a whole different thing. In my experience, depending on your age, your case, and what you've done, there's a bunch of variables. But if you're working and earning like over $500, really, really hard to get approved. So it just opens the argument for Social Security to say, well, listen, if you had better treatment or that medication was different or somebody gave you a job with reasonable accommodations, you could work.
All right, this one's from A1 in Florida. On SSDI, I have Medicare, Florida Blue Premier, HMO. How can I maximize benefits?
A few things you can do. One, your annual notice of change, review that, make sure that that plan is still working for you. That's one. And then 2, in October, the new plans are going to be out. And it's difficult for me to speak right here without knowing what your needs are and what you're looking to accomplish. I'll give you an example. If you're on a plan in Florida and you're not doctoring a lot, maybe you just have a back, you're on disability for your back. And that requires you to go to your general practitioner and maybe, pain management. So light doctoring versus somebody that has an autoimmune condition, respiratory condition, they're going to like 5 doctors a month. So if you're just going to a few doctors, you could look at a plan that would have more on the benefit side and less on the doctor side. And more on the benefit side would be more in dental, could have a Part B buyback, so you're not paying as much out of pocket. You could have better shopping credits, that type of strategy. So there's no way for me to answer that question based on the information I have. If you're genuinely interested, I would complete the request for review, put your name on one of the 220 possible candidates that we can help, or definitely stay tuned for next week and the week after, and you can learn how to do it all yourself.
Yeah, it's just a comment about me breaking up the questions, and that is because it's not entered in a paragraph form.
Okay, you're doing great, Jim, as always.
Thanks. This one's from Ronald. They are sending me to the doctors this Saturday about receiving my benefits. What advice do you have for me when I get to see the doctor's form from the SSI? Follow up,
Right.
SSDI rather.
For SSDI, Ronald, I don't know if you're a member here and using our disability approval course, but if you're not, I would definitely encourage you to do that, because lesson 3 in our disability approval course which folks, there's no charge for the membership, there's no charge for the approval course, goes through the 6 things that you need to do to make that independent medical exam a success. I'll give you one of them. Don't go alone. And the reason why you don't want to go alone is you want to go with an advocate who's going to make sure that, one, they intimidate the doctor and hold them accountable for doing the exam that they're supposed to do. And pretty much anybody that goes to a doctor's appointment, an extra set of eyes and ears is helpful to document exactly what was done at each step of the way. We coach people to record them and then take that audio file and we put it in their case file. So they're held accountable to make sure that they are actually going to do that. So that's my word of advice. You can also search around on the YouTube channel if you don't want to join us as a member, you're not, and you can piece it all together. But the easiest way to do that is take advantage of the course.
Right. This one's from Faith. Is Kaiser Permanente, a private hospital in California, a good option for Medicare Advantage?
Don't know. I'd have to look at the plan. I know Kaiser is huge and a lot of plans accept them. So a general statement is it would be good, but I'm not certain without knowing exactly the doctors that you see, all that.
All right, this one's from Mac. I'm on disability due to blindness. Is there an expiration date on my SSDI benefits? I am under 65.
Not an expiration date. When you're awarded disability, you're subject to a review, which is very, very popular now. So you would be subject to a review to see if you still fall within the guidelines of disability. Now, what you could consider an expiration date is when you reach full retirement age, or 65 for most. Then you're classified as a full retirement age. And what that means is you receive your check just like you would, but it's reclassified from disability to full retirement age. And in that situation, it's just your retirement check. There's no continuing disability review. There isn't any earnings restriction, any of that.
Mm-hmm. All right.
Just two more. I have a 1:30 appointment, so
yeah, just to make sure, Brian. I don't know, or I'm not sure if Mark answered Lisa's question, but her question was about hearing aids, and she only has Medicare but have extra help. She's asking if she should try Advantage.
Yeah, I did address that. I think it would be a great idea. You don't have to make the decision to try it, but what you should do is have it reviewed, look at the plans, look at the benefits that are in the plan, including the hearing aids, and then make an informed decision. And keep in mind, if you get on, you're not going to lose anything by going on to it. You'll just pick up the extra benefits, but if you don't like it, you can always cancel it.
Mm-hmm.
One more.
That's it. Oh, one last. How long after a first SSDI denial can you reapply?
Well, you should appeal that rather than if it's within 60 days, I hope. You should definitely appeal the denial rather than start anew. This is a common mistake. And the reason why you want to do that is every month that you've been out of work, you can go back and possibly get back benefits when you eventually win your case. But stay with me, folks. If you get denied and then you wait a month and you file again, your application is going to be from the day after you were denied. So you miss out on all prior past income that you may be eligible for because you were out of work because of this disability. I've seen this cost people thousands. Appeal it. If you're a member here, reach out to us. If not, join us. We can walk you through what the options are. All right, so we're going to wrap it up. Listen, Jam, thank you very much. Thank everybody that's out there. Just a few reminders before we tighten things up. Next week, Philip, Daphne, going to break down the areas to review, the different benefits in more detail. So if you're looking to maximize your benefits, you definitely don't want to miss that one. The week after, we're going to actually do a plan review for you, show you how to take your plan, go through, review it, compare it to other plans. That's another one. If you're new here, you like what we're doing, share it, send this out to others, see if it can benefit them. Hopefully it can. And if you want to get your name on the list, you're serious about looking at your benefits and getting them improved or getting on benefits, below or somewhere around this replay will be a benefit review request. Totally free. You can fill it out. We review the plans, look at what you're on, what you're eligible for, show you the options. We have additional benefits that we provide you that are totally no cost if you do choose to go forward with a recommendation that we have, such as our benefit protection program that will help you survive your continuing disability review. So that's it for today. All right, everybody, be back next week. You've been a great group. Thanks for joining. Okay.